everyone, welcome back to my channel. I am Arushi, a third year dermatology resident. I have with me Dr. Shahrukh, who is a very talented fellow third year resident. So today we are going to help you with the NEET PG counseling. I also have a playlist called NEET PG counseling playlist, wherein I have put detailed tours of various dermatology departments across the country, and I've also put in a few interviews with eminent faculties as well. So you can go visit that. That will help you choose your branch better. But besides that, today we are going to tell you how our entire experience in the 3 years with dermatology has been like. So would you want to start it off?
Sure. Dermatology, I think if you rearrange the words of the word derma, you get dream. So if it's your,
Yes.
that's what I would say. If you really want to do dermatology, please go for it. Don't go for it's a female specific branch. Male लोग क्या करेंगे?
I sometimes feel like that also, but
No, but as you've seen, most of the eminent
yes,
faculty
I saw
are
today.
male.
I saw today. We were in a conference where I saw that some of the top dermatologists of Delhi are all males. So Shahrukh is a good example of that as well, that we should not restrict the branch to a female specific branch per se. But also, जैसे अगर मैं अपना experience share करूँ तो I was so determined to only take derma. I was getting so many seats at so many places. मतलब मुझे एम्स में anesthesia, patho और peripheral एम्स में surgical branches भी मिल रही थी. And at my rank, I would have got something in Delhi also. But I was very 100% sure that I'm going to take derma. A lot of it was based on what I experienced during internship. And after 3 years, I can say that my entire journey has been nothing short of a vacation. Or like a dream. I mean, I like working so much. They say, काम ऐसा ढूंढो कि तुम्हें ऐसा लगे कि तुम हाँ तो ऐसा काम ढूंढो कि तुम्हें एक दिन भी काम ना करना पड़े. So that is what derma has been like for me. And I'd say that I have been around a lot in the sense that I've been to conferences, I've met people, I've met good people like Shahrukh here. So I have experienced the branch in a lot more depth, I would say, than my previous videos. तो उसके बाद भी if I'm saying that I like it, तो I'm saying it with more experience. So one of the things that I like the most about the branch is that it gives you the best of both worlds. Clinical भी है हमारे पास, surgical भी है. I really like to diagnose cases in derma, and we do get a lot of variety क्योंकि infections हैं, autoimmune diseases हैं, genodermatosis है, फिर तुम्हारे scalp के lesion अलग हो जाते हैं, nails के अलग हो जाते हैं.
Disorders, lots of things, and it's all clinical. बहुत investigations are also not needed या जो भी investigations है bedside है, it can easily be done.
Yeah. Also, एक और मुझे जो अच्छी बात लगती है कि therapeutics में भी we have plenty of options. Contrary to the conventional belief कि derma is all steroids या फिर Tenian scabies, I think we have come a long way from there. We have biologicals which are there, and then there are other immunosuppressants. तो वो भी देना ना एक art लगता है मेरे को. मतलब even if you're just giving steroids, क्या monitor करना है, किस patient में क्या side effect आएगा, तो throughout my residency I saw peptic ulcer और क्या बोलते हैं pemphigus का oral ulcer. कैसे तुम steroid induced oral ulcer है या तुम्हारा pemphigus का है, how will you differentiate? तो steroid induced psychosis है, steroid induced तुम्हारा joint pain है, कुछ osteoporosis है. तो मतलब I've seen plenty of side effects of steroids as well. तो मुझे क्या लगता है कि immunomodulators देना भी एक art है, which you will eventually pick up during your residency. Besides that, would you want to add something on this?
I think it's all trial and error. What maybe works for one patient may not work for everyone.
Yeah.
It's an ever-growing branch. Every day new advances and new discoveries are made, and you have to keep in touch with your academics if you want to grow as a doctor overall.
Yeah. Outside of the clinical cases that we see in OPD, I mean the conventional skin or hair or nail cases, we also see a lot of venerology and leprology. So that is another thing. उसके अलावा I think one of the things that attracts people the most is the OT. A lot of people pick this up, and I think that is a very good perk of derma. I mean, looking good is part of our job. So I really like that part. I mean, when I use all those serums and all those hair care products, and we get them we get them every day. Like whatever latest hair care product a company launches, the first people that they want to show it to is probably a dermatologist. So I feel so privileged that, I get to do skincare and best hair care, and it is all part of my job.
So trust your dermatologist. के सबसे पहले guinea pigs हम लोग ही हैं. We say try before you buy, and we try it on ourselves. और हम लोग के घर वाले.
Also मतलब as in when I see dermatology people doing skincare influencing on Instagram, which is also like a very new thing. I don't think Instagram pe any other doctor is watched that much. Nobody will watch, I mean, a surgeon or somebody as much as they will watch a dermatologist talking about skincare. That is what I've seen. I mean, the numbers validate this as well. So I think that is also something that I really like. I like social media presence. I like to look presentable. I mean, I don't look presentable most of the days, but when I do look presentable, I want to be good. So my profession kind of helps me take care of everything in totality. Also, if you have hobbies, which I think a lot of people have, like work-life balance wala part. So I have, my parents are both doctors, so I have seen the other side as well. When you take up very emergency-oriented, I mean branches with heavy emergency caseload. So in that case, you don't get to plan your life. You don't get to plan your vacations. You don't get to plan your kid's birthday or your own birthday for that matter. So in that case, I feel derma gives you that work-life balance, and that I think is a very good perk. So
I think you need to pursue hobbies or things that you like during residency to keep you sane.
no. I mean, if you get to do it, I mean, it's not a compulsion, but if you do it,
But you should take time out for it. सब
Yeah.
कुछ लेके चलना चाहिए.
that is what I personally did, and I feel that it kind of helped me.
That helps you grow as a person.
It makes me what I am today. So that is what I feel, that you get plenty of work-life balance, because we do OTs, we do have cases. None of the things that we do have emergencies, to be honest. Like, there might be emergencies, but they are very less in number, and the pre-op post-op is not that heavy. So we kind of get to plan our OTs, we get to plan our OPDs. So we have our life a little, we might have our own setups, but we have our life in our control.
Dermatology emergencies do happen, and if they do happen, you have to attend it very promptly, because usually ICU से phone आता है कि ये rash है, ये ulcer हो रहा है, and you have to rule out SJS10, and other specialities will not be able to diagnose what
ये तो
dermatologists
है,
do.
ये तो है, मतलब I mean, rash से none of the physicians would probably think of drug. Their first thing would be fever or this disease, that disease, but we would go there and we'd say that
Drug-induced exanthem or a viral exanthem or an infectious disease.
I would not say that other people cannot diagnose it in entirety, but then
Just to be sure, medico-legally, it's better to consult whenever in doubt.
yeah, about the cosmetics part also, like I've attended a few workshops and conferences wherein I've seen that people are doing a lot of Botox, fillers, transplants, then there's body tightening procedures, and there are medifacials, then there are all these anti-aging procedures. To be honest, this is not something that you see a lot in residency, and if you don't do a lot of this in residency, I don't think you miss out also a lot, because you can always pick this up later. But then your base of how these things are going to work, how these things are going to be effective for you, is probably going to form during your residency only, because you'll learn about the physiology, anatomy, and other things of nail, hair, skin in depth.
You get to know why something happens, how it happens, and how to deal with it.
Yeah. So for people, now I'll just give you a brief comparison between branches. You want to say something? You want to add
About-
something about derma as a branch?
Derma as a branch is very promising, and it's one of the most appealing ones. The difference, I would say, I mean, the only subject that you can maybe compare with it as per what we've seen is radiology. So if you like patients, take dermatology. If you don't like interacting with patients, choose radiology.
Also, I think a lot of people have this misconception that derma is getting saturated and stuff, or maybe we do not earn as much. But let me tell you one thing, the order in which the branches are picked is not just corroborates with the work-life balance, it also corroborates with how much money you make. Always. So radiology, I think it gets over by 1,000-1,500 rank. Derma usually gets over by 2,000-2,500 rank, and medicine then follows, and then there's pediatrics, and then all the surgical branches come. So I think this is in order of not just the work-life balance, but also in terms of the monetary returns. Especially for radioderma, I'd say, if you want to earn money with the peace of mind that everybody wants. So these are the branches that if you want both money and peace of mind, these are the branches that you should consider. The thing is, it completely depends on you. You can have as exhaustive OT as you want, or you could have like a very basic practice also. You could join an educational institution also.
Absolutely.
So you have plethora of options, but I think as an MD, as a specialist, you can always do well, like as well as you want to do. So that is one thing. Other than that, if you want to compare it with branches, I would say if you're confused between medicine and derma, I would say it wasn't very difficult for me to pick derma because it's like an end branch. So you don't really have to do a DM after derma. It's more like medicine. I mean, it's more like enrolling into a DM course already.
It is a super specialization outside India.
Okay, so it's like you have to know a little bit of medicine, but then skin medicine I'm kind of practicing, so that is one. If you talk about pediatrics, I feel that I have pediatric patients. We do get like 20 to 30% of our OPDs usually kids, but the only good thing is our kids are not that sick.
Hopefully, touch wood.
So you won't see a lot of mortality, but then you would get to see pediatric patients also. In case you just want to see pediatric patients, or if you think that you would be able to do justice to having very sick kids around, you can go for pediatrics. But if you want to see pediatric cases but with a little but you don't want to see a lot of emergencies, then probably like you could choose derma over pediatrics. Also, if you compare it with any of the surgical branches, obviously like if you talk about surgery or OBG or orthopedics, we probably do not open up people's abdomen, or we do not work them up pre-op or post-op that rigorously. But we also do not deal with a lot of complications that are bound to happen in those people.
You need to know what you want to jump into, what you don't want to. जो आपके डोमेन में उस पे आप ऑपरेट करिए. जो आपको लगता है it's beyond you, no need to take extra hassle. And with dermatology surgeries, you can give instant results. That's one very gratifying thing. But always counsel your patient beforehand. Give them realistic expectations. Don't give them unrealistic ones कि आप ये celebrity वो celebrity जैसे हो जाएगा. Patience is a virtue. And you need to know how to talk or counsel patients, whether it's the dermatological portion or especially the venereological part or the social stigma that comes with leprosy.
True. Also, like I think one of the advantages over the other surgical branches is that the procedures that we do, एक तो instant result है, दूसरा they have more of an artistic side to them, which is what I like. Instead of running into complications, I'd be running into a person who looks younger, or who looks better, or who's happier after what I did to them. So I think it's a very happy branch on that note. Also, I think today we were discussing in the conference that medical legal cases are very rampant in the other branches. So Consumer Protection Act and all includes doctors. So I think it is very hassle free to be a dermatologist. Even radiologists get those PCP and DT cases. Then gynae people, so they're always after them. Surgery also, something goes wrong, somebody dies, and then there is chaos. So life death kind of situation is not there in derma. So you won't really get sued or something.
Have you ever written a DC during your residency?
I did actually. I had to write 8, but
wow, okay. But you, like she'll say, I think it's a very rare thing.
Yeah, but we have a lot of inpatients, and we keep good number of people in our ward, so that is probably why I had to do it. But otherwise, it's not like that.
As a private practitioner, I don't think उतना hassle होता है, उतने वैसे critical patients आएंगे.
So all the chaos that we hear of, like people beating doctors, people burning doctors' hospitals, people filing lawsuits against doctors, all happens because when people die, people are not able to process their relative dying, and they vent it out on the doctor. But with derma, I think nobody dies. So we never have to deal with somebody's relative dying. It never comes on us.
No, but you need to counsel properly, especially leprosy or venereal disease.
Yeah.
If husband, wife, one of them has it. It's a very interesting residency. You'll hear a lot of funny cases.
Yeah.
It's very entertaining when you go back home and you discuss with friends. Obviously, we maintain patient confidentiality.
Yeah, that is true. Also on that note, I feel that HIV and all are also very like on the HIV is like the new pandemic that we're going to face, that we are kind of facing only. So they are on the rise. So all the STDs and all are also on the rise. So the clinical side also has a great scope. The skincare side, the cosmetic side has a great scope. The surgical side has a great scope. So I think overall the branch is kind of growing, and in 3-4 years from now, it might even be at a higher pedestal than where we see it today. So in case, if I have to compare it with other or kaun si branch reh gaya? I think I've compared it with almost every branch that was there.
There's also scope for a lot of academic research in dermatology. So if you're interested in that, you want to make a name for yourself, there's a lot of avenues, a lot of scope. There's a lot of IODVL fellowships and things that you can pursue. That's only very short, also 3 months, 6 months. So it's a very promising future that lies ahead.
Yeah. I have made a video on the fellowship options that we have, and that is based on the list that they put on IADVL's website. So that fellowship wali video will kind of give you an idea of the variety that we see in derma, including cosmetics, surgical, non-surgical, clinical, everything would get covered in that one video. So you can go and watch that as well. I think this was a very elaborate one. And do you want to add something?
Hopefully, I think the people watching, it's helped them out, helped clear up some of their confusions. In case they still have any questions,
No,
she's
you can-
available
you can
and I'm
be
available
sure.
on social media. You can approach us, ask us, and we'll try to help you out.
Yeah, you can talk to Shahrukh as well. So thank you for watching this video. Do put your comments below and let me know if there's something more that you want me to talk about. And I also keep updating my videos as I get to know more. But then if I talk about what all I've seen in the past 3 years, other than the clinical cases that I saw in derma, well, like in the OPD, which was like a huge variety of cases from genodermatosis to geriatric to pediatric to drug rashes to your infections to your autoimmune diseases to all those STD and leprosy cases, etc. So there were like a plethora of cases that I saw in the OPD. I learned dermoscopy, a little bit of pathology we know, and a lot of microbiology help we have to take from a microbiologist, and we also do like minor lab procedures ourselves. We do a few bedside procedures ourselves. Also, we had like transplant workshops, Botox fillers workshops. Then there are vitiligo surgeries that I learned. Then there are nail surgeries that I learned. Then there are various cutaneous tumors of all sorts. There are malignancies. There are some specific like Mohs surgeries and all of that. They recently opened like a center in AIIMS also. Then there are mole removal, scar removal, all of those procedures. There are so many anti-aging procedures. So those are all the things that I saw in the workshops that I attended.
Invasive and non-invasive. For the people who are scared of injections, there are non-invasive methods also.
Yeah.
Lasers are a friend as well.
Yeah, lasers are there. So lasers, especially like the ones for scars and hair removal, they are very effective. Other lasers, like for certain indications like vascular malformations and all, we use them and they are very
Pigmentary
effective.
disorders.
Yeah, pigmentary would not go completely, but a lot of it is reduced. Yeah. So I've seen dermatologists making significant changes in people's lives. And I have also explored the social media platform as a skincare influencer and a dermatologist. And I feel that it's so gratifying because I have followed like so many people who are dermatologists, and I keep seeing their videos and I keep seeing the work that they are doing. And I also keep posting about the work that I do, or I also keep saying about the skincare that I come across or the skincare that I use. And personally, I think when you use skincare, when you work on yourself, when you work on grooming yourself, it kind of makes you very happy. It is always very satisfying to help you attain your full potential, and to help other people attain their full potential is even more satisfying. I think I have followed, if you see, plenty of dermatologists are doing so well on social media. Whenever they have any big skincare company, whenever they launch something, they call derma people. So I think skincare and the social media market is also something that dermatology kind of is in sync with. So if you like a social media presence, if you like to be creative and artistic, that's also something that you can do.
We'll make the skin healthy, most importantly. That's why the skin glows extra.
Yeah.
And we offer long-term results. It's a very important thing that I would say the gratification and the smile with which a patient comes back when you treat their acne, especially acne with scars or
Yeah,
something.
because it's everything is visible on the outside.
It
You
changes
do-
lives.
Yeah, you do a big surgery, people won't know. But if you treat a minor acne only,
Which is, it's all visible. So any
Yeah.
visible things, any scar, any mole, any wart on the face elsewhere,
so it helps with the quality of life a lot more than, you know, treating hypertension or diabetes. Obviously, you need to treat hypertension and diabetes, but then when you treat something like this, people are like very happy.
and
They're
people nowadays
happier.
are very conscious with their looks and appearance.
Yeah, I think that was very elaborate and we'll edit it nicely. So thank you guys for watching this video. In case you have queries, drop them down below. Also, there are other videos that I've made on counseling, so you can give them you can go and visit them once and see whether you like them or not. I have put about various medical colleges and the equipments and all that they have, and I have made videos with a few faculties also, so you will get a better idea of how derma is through them. So yeah, keep watching. Thank you.